Hello, everybody. United States Senator Reverend Raphael Warnock here. I want to thank the president of the Georgia chapter of Postpartum Support International, Chantel Cargill, for all of your dedicated work to strengthen maternal health care in our communities. I'd also like to thank the families attending and the clinical experts who are coming together to address such an important and fundamental issue, the health of our mothers. What could be more important? Tragically, too many women, especially Black women and women of color, are losing their lives unnecessarily during and after childbirth. That's unacceptable, especially here in the United States of America, the richest nation in the world. Women also need access to mental health services to help them through pregnancy and after childbirth, which can be extremely challenging, a challenging time to navigate. And that's why the conversations you are having today and the work you are doing is integral to making progress on this issue. Know that as you do this, that I am your partner in Washington in this fight. That's why I was proud to partner with my Republican colleague, Senator Rubio, last Congress to pass a bipartisan law that will strengthen the federal government's efforts to address the problem of maternal mortality and morbidity. I'm also pushing Congress to make critical investments in our nation's mental health care system. And our work is cut out for us, especially after last year's misguided Dobbs decision by the Supreme Court. The fight to restore the right of women to determine and access their own care will continue. And know that I will never, ever back down from this fight. I'm proud to stand with folks like you on the front lines, dedicated to fighting this crisis and helping to protect our mothers. Thanks so much. Have a great and productive summit. Keep the faith and keep looking up.
Wow, thank you so much, Reverend Senator Warnock, for those kind remarks and all the work that you do for maternal mental health in our Senate. So next, I have the honor and the privilege of introducing our own Liz Ruth as we transition to our advocacy portion of today's summit. Liz Ruth is a mother, a wife, and a policy wonk. She currently serves as the Advocacy Chair for Postpartum Support International Georgia Chapter. For her day job, Liz is the Vice President for the Center for Health Policy at the National Association of Chronic Disease Directors, where she advocates for chronic disease prevention and health promotion policies at all levels of government. With a career spanning over 15 years, Liz has held various positions, including a research fellow at CDC and a legislative assistant in Senator Deb Fischer's office. She is dedicated to advocating for chronic disease prevention and health promotion policies at all levels of government. Everyone, please help me in welcoming Liz Ruth.
Thank you so much, Chantel. I am so excited to be with you all today. It's a really tough act to follow. All of the speakers today have been so fantastic. And I just have to say, seeing Senator Warnock's video, I think we are all so lucky to have Senator Warnock representing the interests of Georgia in DC. So like Chantel said, my name is Liz Ruth. I am the Advocacy Chair for Postpartum Support International Georgia Chapter. I'm also a wife. I'm a mother of 2 little boys, and I'm someone who's experienced both postpartum depression and anxiety. I'm really honored to be able to speak with you all today about the importance of advocacy, how to get started as an advocate, and then we have the honor of hearing from 2 legislators who share in our passion for Black maternal mental health. I understand that advocacy at times and to advocate can feel like intimidating words, but I want to let you all know that you're all already advocates. I think really, to put it simply, advocacy is about working on behalf of others to make systems better. Being here today shows how much you care about these critical issues, that you recognize that there's a problem in the system and that we need to work together to change it. In my opinion, genuine passion and a desire to change the status quo are the critical elements for being a great advocate. So I feel very, very safe that everyone who is participating in this event have both of these key elements to bring to the table. So in addition to bringing passion and desire for change, I do want to give you all a few tips on how to effectively advocate on the issues that you're passionate about. My first tip is know your elevator pitch. Be able to quickly and concisely communicate your message. This will give you confidence and the capability to talk to any decision maker or legislator about these issues. In my experience, you truly never know when you're going to get the opportunity to educate and activate others. You never know when you'll be on a flight to Washington, D.C. and Senator Warnock may be there. And if you've got your elevator pitch ready, you can use those 2 minutes in the check-in line to tell him a little bit about the work that you're doing. Second, don't be afraid to say, I don't know. I'll speak for myself that when I feel like I have to have all of the answers, it can make me hesitant to speak up. But as advocates, you don't have to always have every answer. Developing relationships with decision makers and legislators, it's about building trust. So being able to say, I don't know, but I'll find out is really critical. And then my third tip is always follow up after a conversation. Again, the heart of advocacy is about developing long-term relationships. And sometimes really it's about being the squeaky wheel. But either way, continuing the conversation and the relationship over the long term is really important for successful advocacy. I just want to share that I, on a very personal level, do understand how intimidating it can be when you've never engaged in the process before. So I've worked in advocacy and government affairs for over 15 years, but until this spring, I hadn't set foot in the Georgia State Capitol since I went on a field trip in elementary school. So I'm not going to lie, the first time I walked in, I was intimidated. I didn't know what I was doing. I didn't know where do I go, who do I talk to, where do I stand? But I was lucky enough to have friends and colleagues who had been there before, and they were willing to guide me and answer my questions, and were really just willing to show me the way. So my hope is that PSI Georgia can be that resource for you. We're working in partnership with Healthy Mothers, Healthy Babies of Georgia to form a perinatal mental health task force. And one of the key elements of that is going to be our advocacy committee, where we hope to bring together advocates like you all to communicate how Georgia families are affected by these issues. If you're interested in joining our efforts, you can email me at advocacy@psiga.org to express your interest. So again, I really appreciate you all letting me speak with you all, but I really want to introduce our honored guests. So let me check one thing before I kick off. Fantastic. All right, I am going to introduce both of our speakers, and then I'm going to give them both some time to introduce themselves. And then I know I have some questions, but if you're listening and you have more questions, please feel free to put them in the Q&A box. So first, we have Representative Kimberly Alexander. Representative Alexander is a native of Paulding County, Georgia, and the first female Douglas County resident elected to the State House. With a master's degree in administration and a bachelor's degree from Morris Brown College, she is committed to representing her community. Representative Alexander's election to the House is historic, as she is the first female Douglas County resident elected to the State House, and she is the first African-American female elected in Paulding County. So welcome, Representative Alexander. We also have Representative Park Cannon. Representative Park Cannon is a passionate advocate and member of the LGBTQIA+ community. Representing Georgia House District 58, she aims to make a positive impact in her vibrant district. Her commitment to social justice was ignited during her college years, and she has worked in health promotion and as a health advocate. She brings her unique perspective and dedication to her role as a state representative. I also want to mention Representative Cannon is also a labor doula. So I want to first of all thank you both so much for being here with us today. This is so exciting. And to kick it off, I'm going to turn it over to Representative Alexander. I wanted to give you a few minutes to introduce yourself to everyone.
Thank you so much. I want to thank Chantel in the Georgia chapter for the invite. I am so excited to be here. This is one of the issues that is at the forefront of the Georgia Women's Legislative Caucus, where I am also a co-chair in the House side, and we have another co-chair over in the Senate side. I have been in the legislature for 11 years. So this has been one of the topics. Maternal health, mental health. Health is one of the first bills that I passed when I was in the Georgia General Assembly when I first came. So I'm happy to be here and look forward to having this dialogue with you guys today.
Thank you so much, Representative Alexander. Now, Representative Cannon, I'd like to turn it over to you for your introduction.
Hey, everyone. I hope that you're able to hear me clearly. I just landed in Washington, D.C. to do some more advocating on the issues that you care about. I want to share with you that even as a legislator of 7 years, I too have to make my voice heard to different types of policymakers so that they understand the impact that policies are having on a state like Georgia. As a labor doula who literally just helped someone have a baby last night, and then hopped on a plane this morning and will get back and help someone else have a baby on Monday morning. I think it's really important that if you have a story around birthing, that you make it concise and start to be able to share it. And I can talk more about that, especially wanting to expand on what you shared, Liz, which is how you put together that elevator pitch and how it can be so timely for legislators like us.
Well, thank you so much, Representative Park. And you stole my thunder a little bit because I think you anticipated my first question. So if you don't mind kicking us off, can you go in depth a little bit more in terms of advice on how attendees can effectively advocate?
So the first thing is really going to be have a story that you can share in 30 seconds or less. You want as many specifics as you can put in there to show who you are, why you're connected, and why you care. So that could be you saying something like, my name is Park. I grew up here in Georgia and was born in a hospital, but my mother, Miss Cannon, was unable to birth in a hospital because there were still segregated hospital systems in the 1950s here in Georgia. I learned and I started caring about this issue because I want to make sure that all birthing people, whether they're in Atlanta or in South Georgia, where I'm from, have an opportunity to have a safe birthing experience. That's an opener that a legislator would be interested in. They feel like they know you, they know your family, they know what issue that has been longstanding that has not been addressed, or where they can become a part of the solution. And then you go into the second part, which is something specific about legislation or something specific about an issue. So you could say, did you know that 1 in 3 people in Georgia have ever experienced pregnancy loss? Did you know that the mental health concerns that come with those issues can look like anxiety, depression, or hyperfixation? And you'll pause and you'll see if they know any of those things. You might want to add one more statistic like, well, did you know that right now there are access to federally qualified health centers, but unfortunately, all of those health centers don't have OBGYNs. There are over half of counties in Georgia with no OBGYNs. And that's something that as a legislator, I would want to grab onto and say, wait a minute, can you email me all of that? All those statistics you said, or can you text it to me? It makes me want to see you as a subject matter expert on something that is your lived experience and maybe something that you've researched. And the last thing would be to close up with a quick way to stay in touch with you and something memorable. I might say something like, I hope you'll always remember my shirt that says Trust Black Women. You can find me and our organization here.com. And I'll also make sure to follow up with your administrative assistant with an email about everything we talked about. There it is.
Wow, fantastic advice. Representative Alexander, do you have anything to add to the advice for advocates?
So I would say that for everyone that's listening, it is so important that you know who your local elected officials are. You need to know them from the commissioners, the school board, the DA, the judges, everybody, state legislator. So you can find out who your state legislator is by going to the Secretary of State's website, and that will tell you who your congressional person is also. Your state house member, your Senate member. It will give you all that information. We're in session for 3 months, January through March. I would also encourage you to visit the Capitol, to come down and see us, to schedule an appointment with us, to contact us through email. And you can look at www.legis.ga.gov. That will give you a list of every last senator and House of Representatives. So, and you can always email that individual person then, but make sure that you know who is your representative in your district. Now, and also make sure that you're reaching out to that individual person. The best way to advocate is through your legislator. So even though we have 139 counties, there's a person that represents each county. It's not often that I get an email from people who are sending it to probably the whole entire legislature. And I have to say to them, listen, who is your state legislator? A lot of people don't know that we can advocate on behalf of you for your unemployment. For any state entity in Georgia, we can advocate for you if there's an issue that you have. So I would encourage people to make sure that you are doing what? Advocating. And you can also through this organization or any other organization that is an issue to you. If it's this, then make sure you're organizing and you're communicating and advocating through this organization. If it's mental health, make sure you're looking at those organizations around mental health and you're advocating through those organizations.
Thank you both so much, because those were just golden nuggets of advice. The way that you both were able to put that so succinctly, I am in awe. So thank you both for sharing that. I do want to go to our Q&A. We do have a question quickly. So this is from Shayna Lark. I have experience in Florida, Arkansas, and now in Mississippi. No matter where I reside, what's the best way to advocate in the space that we are? So she's asking, the follow-up is, so emailing our state representatives is a great way to advocate?
Yes, make sure you email, and even if you calling them. But I will tell you that when we're in session those 3 months, it is extremely difficult. We're there for a period of time, so sometimes it's difficult for us to get back to you, but definitely if you email. I am a good constituent service person that anytime I get emails, I email back. So make sure you're doing that, going as far as emailing.
Now I've got to bring it in one time for the younger folks. As a millennial at the state capitol, there are so many elected officials who have social media profiles. And a lot of times we want to engage with your community. So if you come up to the Capitol and you take a photo with us, with your group, we want you to tag us in your social media. We want you to send us a direct message and say, hey, we're the ones who came and visited you in March discussing fibroids and mental health concerns. Because then we can go back in our social media, or perhaps our interns can, and they can look and see as well, oh, this is who you were talking about fibroids and mental health with. So let's continue to stay computer savvy with it as well, because all of our sessions are live streamed on our website. And sometimes legislators go above and beyond and do live footage at the Capitol too.
Again, thank you both for those insights. I'm here taking notes myself, so this is wonderful. I did want to ask you both, do you guys have either of you have any stories about maybe how advocacy had an impact on your work or maybe the work of your colleagues?
Now, I just want to talk from the perspective of the Women Caucus, because the issue of maternal health was such a big issue that what occurred with us in 2020, the Georgia Women's Legislative Caucus leadership wrote a letter to the chairman of appropriations, asked him for $15 million to be added in the FY21 appropriations bill. And that was to make sure that we were extending out the postpartum days from mothers from childbirth to 6 months and curb the rate of maternal mortality in Georgia. I think Representative Cannon helped to write that letter at that time. As a result, HB 114 was signed by the governor, which extends eligibility of new mothers for postpartum Medicaid coverage. So we have been at the forefront of this issue, and we will continue to do that. Also, what we did was, from the standpoint of the Georgia Women's Legislative Caucuses in 22, based on the Supreme Court Dobbs ruling, the Georgia Women's Legislative Caucus wrote a letter to the governor outlining the serious concerns for the health and well-being of pregnant and postpartum women and infants in Georgia. And so as a result of that, we then had a summit. We called it a symposium titled Roe versus Wade, the impact on women and children, where do we go from here? And what you guys are doing today is what we did similar. So we had all these individual speakers that came in and spoke with us at the symposium, where we talked about a number of things surrounding the Dobbs case, maternal health. As a result, what we did is that we drafted legislation. So we didn't just have the symposium, we also came up with some action plans. So we had, and what came out of there was a number of things, but what we filed in 2023 was a bill, and myself and Representative Cannon has sponsored this bill before. We just added a little bit more details to it. It was the HB 78, the paid sick leave. And what that bill does is it requires employers with 25 or more employees to implement a paid sick leave. We know there are thousands of people in Georgia that do not have paid sick leave. So under the policy, workers can accrue at least 56 hours of paid sick leave. Now, this bill did not get a hearing, but we know that if this bill would have passed, that would have helped, mothers and workers that have infants. It would have given them that time off for them to care for themselves and their new baby when they're sick. It also will help to relieve some of the stress and financial barriers between work and caring for a child. So we would continue, but from every standpoint, that came from people advocating to us and saying, hey, we want to see paid sick leave. We want to see more things put into the budget as it relates to maternal health. And that's what those things came from other people outside that were advocating to us, including what we wanted to see done.
Thank you so much for sharing that. We have about 5 minutes left. I wanted to, we have another question in our Q&A box. And I'm curious about this as well. You all have talked about sort of some of the differences between when you're in session and out of session, but the question is year round the best time to engage? Is there a certain time frame that's more helpful to legislators for advocates to reach out?
I'll just say that a lot of different organizations choose what is their month, and then they have their programming. So if your organization has a month designating an issue, then make sure to invite us to that event. Reach out to us 2 months in advance and say, hey, want to let you know that this event is coming up and this will be our month. Reach out to us during legislative session and say, hey, in about 6 months, we'll be having our month and we would like to invite you to an event. And so you can kind of walk backwards from your special time of your event to us as legislators. Secondly, I will just share that we do have administrative assistants who work at the Capitol year round. So even if we are not in legislative session, you want to be buddy-buddy with our administrative assistants. She wants to be excited to hear you on the phone or to see you coming, so that when we do get back into session, if we have a tight window for short meetings, she recognizes your face. She knows your name. She knows you're a safe person who is going to come and give us facts and statistics. So she'll squeeze you in when perhaps if it was your first time, she might have to do a little bit more vetting.
Can I just add also to, like, if there's anything today that comes out and in your mind you're thinking, oh boy, this would be a great bill that can be drafted up, I want to give this to one of the legislators that were on today. The emails are there. I've given you that insight and where you can go to get the emails. Email us. I start working on my legislation, even though we're not in session right now, we have an opportunity while we're out now. People are emailing us about various of things. When I get those emails, I research myself before I just say, hey, this is something I'm going to do. So I do my research when we're out of session. And then by October, we have an opportunity to pre-file bills. And so I typically pre-file about 2 bills prior to my even coming back in January. So make sure that you're because sometimes you're thinking about, oh boy, this would be some good legislation, but it's going to require a little bit more thought process when it comes to us. So that's why I do my own research around it. And then we have people that are at the Capitol that can actually write and draft up this legislation so we can make sure we're on the same page. So reach out to us. I would say reach out to us throughout the year. If there's things that come to your mind and you're thinking this is good legislation, make sure you email us and reach out.
I just want to thank you both so much, not only for the incredible wisdom that you've shared with all of our potential advocates on this call, but for all the work that you do on behalf of all of us. I personally am so proud to have you both in the legislature fighting the good fight for all of us. So just, thank you for your time. We have about 1 minute. If there are any just last quick thoughts you wanted to share with the group.
Advocate, advocate, advocate. Do it through this organization or any organization that you can be a part of. It is so important that we hear from you guys. We hear from so many people that come down there, but it's so important you're hearing from the community about the issues that matter to them.
And Representative Cannon, anything to add?
Just continue to consider running for office yourself. We need more moms. We need more moms with babies. We need more folks who have experienced loss or who have mental health challenges that they've been working through to be able to be champions of the issue on the inside. So if you're interested in running for office as well, start looking into that process by contacting your county parties or by reaching out to me. I actually wrote a little book about it, and I would be happy to give a free copy to anyone who reaches out to me. Because of you being here, I would be happy to share that with you.
Well, I cannot think of a better way to wrap up this session. Again, thank you both so much for your time, for your public service, for your dedication. We are so, so grateful to you. So with that, I think I'm going to turn it back over to Chantel.